I'm Dr. Traveler.
And I'm Dr. Quinn.
I've been practicing chiropractic for 15 years.
And I'm in my first year of practice.
I specialize in sports science and rehab along with acupuncture.
And I'm certified in Webster Technique, and I specialize in pediatrics and pregnancy patients.
And we are the Healthology experts, where we discuss the art and science of health. All right, you guys, well, welcome everybody. We're back again. So, number 2.
Yes.
We made it. We made it at least 2 in. Today, what we decided we're going to talk about. So really, we'll get these questions. And I got a question on our Instagram this week about adjusting kids and babies, mainly because we brought in Dr. Quinn, and she really specializes in that with pediatrics and helping with moms during pregnancy, things like that. And so, yeah, we've been seeing more of those questions like, what do I actually, so my baby can get adjusted? I've heard that, and I have some questions. So we thought for this week's episode, we wanted to kind of get those questions answered. So we've got our resident expert here, Dr. Quinn, and so that's where we're going to go with it. So let's start with this. Dr. Quinn, adjusting children.
Yes.
Tell us why a mom should not be worried about that. Because what they all picture is you hanging onto a little newborn's head and doing a manual diversified, big crunch, pop and crack, and that makes them nervous. So
yeah, so the way I explain it to new parents that come in is I say, well, the majority of the parents have already been to a chiropractor, so they kind of know what a chiropractor does. They're used to the normal pops and cracks. So I like to emphasize that that is not what we do to newborns. When they start to get around 4 or 5, then we'll start with a little bit of that, but newborns is mostly very gentle touch. So I like to explain it as I'm putting pressure, as putting my pinky on a cherry tomato. It's very light, very gentle. I'm not going to do any twisting or popping, anything like that. I like to focus a lot on their little hips and then the top of their neck. The top of the neck is where their nerves come in for rest and digest. So getting that adjusted helps a lot with constipation, if they're having sleep issues. And then I always like to check newborns out, even if they're not having any problems. We like to check for hip dysplasia, so that's any popping or clicking in the hips. We like to find that early on so we can get them help when they need it.
good.
Yeah.
Awesome. Yeah. I try to say that, but she says it a lot better.
Yeah.
So, and I have 5 kids. I've adjusted mine. I've adjusted kids in the past. She's much better at it than I am, but that's really a good way of putting it. Now, the question that I was thinking of is, if I were just a person out on the street, didn't know anything about it, so why no popping and cracking versus why is it so easy? I mean, you say the pressure of a tomato,
So newborns and infants' joints aren't completely formed the way ours are yet. So it's more of a cartilage type feeling. So we are just focusing a lot on the nerves that are coming out of the spine and making sure those are all aligned instead of just cranking them and popping them.
Yeah.
Yeah.
I like to think too, one way that I've once we're a little older, and especially adults, right? We've got bad muscle, we picked on our muscles. We've got a lot of muscle tension. These babies are just so relaxed too. So it really doesn't take a ton of pressure on it too, which is really, it's good to know. That's why if you've been adjusted, if an adult, that's why we don't have to do that.
Right.
For a baby.
Yes.
Right?
Yep.
Okay. Now you've talked a little bit, you talked a lot about some of the conditions, but so what would be, again, just review that with them if they're going, why would I come and get my baby? Or let's say even, let's shift it. You talked about babies.
Okay.
Because the labor and delivery process is kind of traumatic on
is.
both mom and baby, right?
Yes. Yeah.
So we're going to assume that there was some sort of trauma. We work a lot with a DT with the lactations. She's the lactation specialist. You've worked a lot with her.
Yes.
So like these newborn babies, I actually think that one makes more sense. What about like the kids? When would be a good indicator for that?
Okay, so I think, starting off newborns, I think all newborns should get adjusted just because the birth, labor, delivery, that's all pretty traumatic. And then, like the first year of life, we're checking a lot of like developmental milestones, like when they start to lift up on their forearms in tummy time, when they're starting to crawl around 6 months, when they're starting to walk. So that's putting a lot of pressure on those joints, so we like to get them adjusted. And then moving forward with that, then we have like the growing pains that we experience, or athletic injuries, or the bumps and falls when they're outside on the playground, that kind of thing. If they're running and they fall off the curb and they jam their hip, they play hard, so they need the adjustments.
Yeah, I agree. As the question was coming out of my mouth, I'm like, yeah, kids basically, a lot of times they'll tell you. I have a lot of parents who will be like, they're walking crooked.
Yeah.
Like, is that normal? And you're like, no, yeah, let's get them check their hips, things like that. We had one, we were both in the office together, had one come in with like torticollis.
Mm-hmm.
I think I see that. I mean, I wouldn't call it like all the time common, but
I see like almost all babies. Babies are different than like, I think
like a toddler,
like a toddler or even like a young adolescent, because babies, that's why you'll have problems with them nursing on one side rather than the other.
Yeah.
Their brains, so we have like two halves of our brains. Theirs don't completely fuse until like 4 or 5 months. So they are only using kind of like half of their brain in a way. So they only use like half of their body. That's why you'll notice they only look one way. So then we get that neck tightness on that one side, and it kind of pulls that ear down. But then that can go into later on, if they don't get that fixed, then when they're starting school, they get that neck pain, tightness kind of thing.
Love it.
Yep.
Yeah. Okay, I'm trying to just like go through in my head all the different things that, what about for parents, like, let's say maintenance? Are there things that they can do at home for their babies, for their infants, that you think is helpful? And I just popped this on her, so I don't even know. Let's see.
So my main thing is to not put your baby in a position that they already haven't put themselves in. So if they are not sitting on their own, or kind of like sitting with their own support, if they haven't gotten themselves into that position, then they're probably not ready to be in that position.
Okay.
That's why when we see toddlers that are walking before crawling, they haven't gotten those muscles worked up and those hips worked up to start actually walking. And parents like to be like, oh, my child's walking before they're crawling, but it's like, actually they need to be moved down to the ground, try to get them in that crawling position. So does that kind of answer the question?
Yeah.
Like, don't put them in a position if they already haven't been put in that position.
Yeah, perfect.
That's why you hear all the things about like container babies, and then they're used to they're not on their tummy and not working those muscles.
No, that's perfect. Yeah, just like the daily habits.
Mm-hmm.
I like, now the reason why, and again, she's much fresher out of school than I am, but the way I've always, or the knowledge that I have is a lot of that's just because of the spinal curvature, right?
Right, yeah, and tummy time is the main thing. That's what gets that mid-back curve, that neck curve too, so.
Yeah. I always like to say, scoliosis, we don't like. Scoliosis is if you look at me straight on. If you look at me straight on, you want to be straight, right? Mm-hmm. But if you look at someone from the side, they're supposed to have those curves, like it's called lordosis here, kyphosis in the mid-back, lordosis, kyphosis, and it's during those developmental times, right?
Yes.
Like, so if they're not crawl, like you said, if they walk before they crawl.
Yeah, then they're not getting that curve. So.
Yeah. I like it's the shock absorption. Yeah. You're not going to have a good shock absorption.
And then if they're always in the container, then you see that flat head, and then you'll see that going into when they're 2 or 3, you see the flat heads, and you're like, well, they didn't get enough tummy time probably.
Yeah.
So, yeah.
Okay, what about like frequency? How often do you usually, or does it just depend for you? I know for me it varies, but what would be like you said, good to go and get them checked out.
Yeah.
for kids, maybe if a parent's going, my kid's healthy, what,
Yeah.
how often would I have them come in?
So newborns, I'd say right away, as soon as you can after birth. And then if you're not having very many issues after that, maybe 1 or 2 appointments just to get them all aligned. And then we like to look at like 6 months when they're crawling, and then a year. And then kind of just like once a month, once every couple months, just to see if you're wanting to do maintenance care.
Yeah.
But really they're maybe like
Kind of as needed.
as needed, yeah. If something happens, if something pops up, but yeah.
Yeah. So I'd say, yeah, I agree. If there's something that they're battling, like if the kid's having trouble with something, then have them come in more. But I like that.
Yeah. Or if they're playing sports, probably need to see them a little bit more often,
Yeah.
just to keep them in tune.
If they're falling off of crazy. Anyway.
Yeah.
You guys know, if you're watching this and you're a parent, like the kids are doing crazy stuff. So it's nice to get them checked out. Maybe when you get checked out, the adults should come, mom, dad, do it like a family adjustment. Come in, see us, come in, see Dr. Quinn and be like, okay, check everybody.
Yep. And it's not always like muscle and that kind of thing. Like sometimes if you're having a 5-year-old that's still bedwetting, that's a good time to bring them in.
Good
they
point.
can really benefit from chiropractic care, or trouble focusing, trouble sleeping at night, that kind of thing. So it's not always the muscle and bone type stuff, it's that kind of stuff.
Neurological stuff. We see that a lot, because it takes pressure off of the nervous system.
Mm-hmm.
So them recognizing that their bladder is full.
Yep.
Really, really good. I swear there was one more question, but I can't remember, so that must mean that we're done. Yeah. Okay, so again, review, just newborns, come get them checked out. The big ones, if I heard you correct, if they get earaches, if they seem to be having ear trouble, that's a good time to come get them checked out. Constipation, if their belly, they're not digesting, good time to come get them checked out. If they've done some weird thing, or stuff happens to kids and babies and they crawl and fall and hit their heads and stuff. So
all
just
stuff.
life.
Yep.
Okay, I love it. Okay, so again, in here we have 4 chiropractors. I'm one, you could come get checked out with me, but kids, well, everybody, Dr. Quinn, she's like the resident expert there. Go, if you have questions too, you can always message us. You can call into the office. You can come and just have a consult, I'm sure, to sit down with Dr. Quinn if you have questions. Come get it checked out.
Yeah.
She knows her stuff. It's good. Okay.
Sweet.
Any last words?
I don't think so.
Okay. Stay healthy, y'all.
Thank you for listening. Please like and subscribe.
All right, you guys, it really helps if you can go and interact with us. So, as Dr. Quinn said, like, subscribe. Go check us out on Facebook, on Instagram, on TikTok, and keep an eye out for other videos on YouTube. And also check us out, and you may be listening on podcasts. So, all those platforms. Thanks, guys.
See ya.